Hopefully you can hear me. Yes? All right. So I just want to thank you all for coming to our second Parkinson's support group. Um, Tonight we have a couple of ambassadors from Cure Now Parkinson's disease who are going to talk to you in regards to a trial that's happening at Yale, which is being funded by Michael J. Fox Foundation in Yale. I have just a couple quick things that I'm going to announce also. The Senate has unanimously passed on May 23rd that the National Plan for Ending Parkinson's Disease has gotten to Joe Biden's desk, and they're just waiting for him to sign. So that's a wonderful thing.
Is it funded?
Yes, it is funded. Yep. Okay, so I'm just going to go ahead and bring our speakers up. We have Daria and Brenda. They're from Cure Now Parkinson's Disease, which is a nonprofit community partner with Yale and the Michael J. Fox Foundation. They are volunteer ambassadors. Daria is going to talk to you about the trial, and then Brenda is going to tell you about the trial because she's gone through it. So I'm going to turn the mic over to them. Come on up. This is a microphone too. They're taping, so here you go.
Thank you, everybody, for being here, and thank you, Terry, for allowing us to speak today. My name is Daria, and I am a volunteer ambassador with Cure Now Parkinson's Disease. Cure Now PD is a nonprofit based out of East Hartford, Connecticut, and it was started by two people, Connecticut residents, Michelle Hespeler, some of you may know her, and Steve DeWitt. They were both, several years ago, they were both diagnosed with early onset Parkinson's disease, and they immediately became frustrated with the pace of change in regards to Parkinson's medications, treatment, and ultimately a cure. So they started Cure Now with the focus, the initial focus was to deploy ambassadors such as Brenda and I to speak to Parkinson's support groups throughout Connecticut to spread awareness about available clinical trials. Cure Now also does a lot of other things, but the primary focus is to send people like myself and Brenda to speak to people about trials and the importance of trials. Cure Now is also, Michelle and Steve, they talk to politicians, pharmaceutical companies, doctors. They are always networking. So they're doing the hard part, and Brenda and I are just sharing what we've learned throughout the course of our ambassadorship. The ambassador program is a pilot program. We are not paid. Brenda and I are not paid. And we have no affiliation with pharmaceutical companies, just so you know that up front. I would like to talk about statistics before I get into the ketamine trial. I'd like to talk about statistics. Currently, only 10% of people with Parkinson's actually participate in clinical trials. That's 10%. That's pretty low. 85% of clinical trials fail due to non-participation. These are 85% of Parkinson's clinical trials. And that's huge. The researchers and doctors can't come up with new medications or potentially a cure if they don't have a data set to create these new drugs. The reason why clinical trials fail, it's due to non-participation. Again, that's why we're here as ambassadors, to spread the word. And there are 3 top reasons why clinical trials fail. Can anybody give me at least one reason? That can happen. But just think about like where most of the trials are done in a hospital. So one of them is transportation. That's a huge reason. People don't have transportation to from the medical facility because sometimes trials last for months and you have to go maybe once a week or once a month. So that's been one of the biggest complaints, lack of transportation. And some people can't drive, and maybe their caregiver or their spouse can't drive. Another reason is lack of awareness. They don't know the trials out there. That's a big reason. And another reason is possible lack of trust with the medical community, lack of communication. Some people that do complete trials, they don't always get the results after the trial is finalized, and it's kind of frustrating. So people just get frustrated and they don't want to do any more trials because they don't feel like the doctor communicated with them with the results. So that's another reason. So lack of awareness, transportation and distance, and a lack of trust. Today we are here specifically to talk to you about a trial being conducted by Yale and funded by the Michael J. Fox Foundation. This trial is the PD ketamine trial. And we passed out, we call these a rack card. This is just a synopsis of the trial. Yale started this trial over a year ago, and they're looking for 30 more participants to reach the goal of 50 in order to complete the trial. The main purpose of this study is to investigate whether the drug ketamine is an effective antidepressant in people with Parkinson's. I'll talk a little bit, I'm not a medical professional, but from what I know, talking to the Yale doctors who were on a Zoom call every Thursday, Brenda and I, and Brenda knows the doctors personally, and I know them through Zoom, to discuss the background of ketamine. So since 1970, ketamine has been used as an anesthetic. In the 1990s, Yale doctors discovered that lower doses of ketamine had antidepressant effects. And Yale is currently now doing this clinical trial to determine if this is the best drug to treat Parkinson's patients that have symptoms of depression. I'll talk a little bit about the criteria for the Yale ketamine trial. You have to be between the ages of 40 and 80. So if you're under 40 or over 80, unfortunately, you can't participate in the trial. You have to have a clinical diagnosis of Parkinson's and symptoms of depression, which will be determined by Yale doctors. The trial itself lasts approximately 4.5 weeks. And like I said before, some trials can last months. This one is condensed, it's 4.5 weeks. And there's 4 steps. One is just a phone call. On the card that we passed out at the bottom, you'll see a 475 area code. That's the number for the research assistant. Her name is Sophie Elliott. So you'll do a phone call with her. It's 20 to 30 minutes. She'll ask you your questions about your medical history, your Parkinson's symptoms, and any depressive symptoms. And then you can ask any questions you want. If this is all you do, I encourage everybody to call, just to at least do the phone call. And Sophie Elliott will answer all your questions. The thing is, even though we only need 31 more people, not everybody qualifies. Not everybody, has symptoms of depression. But it's worth a phone call, 20 to 30 minutes. So maybe out of this group, we have maybe 12 of you call. maybe only one or two, actually pass the assessment to continue the trial. So we encourage everybody to at least call Sophie Elliott. The next step is an in-person screening visit at Yale. So this is a cognitive and physical assessment done by Yale doctors. This takes about 3 to 4 hours, and Brenda will talk more about this after I talk. And then the doctors will determine at this assessment whether you can continue for the infusions. The next step is infusions. It's twice a week for 2 weeks. You'll be under the care of Dr. Sophie Holmes down at Yale. The infusions, you don't know what you're going to get. You're either going to get the ketamine drug or a placebo, which is a saline solution, but you're not going to know what you're getting. It's a double-blind test, and again, Brenda will talk more about that. And that's infusions twice a week, per week, for 3 weeks, and you can't drive to Yale. For these infusions, you'll have to have either your caregiver or your spouse. Yale does provide transportation if you need it. And you'll call Sophie Elliott on the card. Her number's on the card, and she'll arrange free transportation. And this is huge because a lot of people don't go to trials because they don't have a ride. So Yale has the funding to pick you up at your house. Your caregiver or your spouse can go with you, and they'll bring you to Yale and then bring you back home after your infusion treatment. The fourth step is a 1-month follow-up with Dr. Holmes. So again, that's 4.5 weeks. You'll have the option also to volunteer for a brain scan, an MRI, if you choose to. The infusions are, you have to have the infusions, but the MRI, Brenda will talk more about that, that's voluntary. But you can, you have the option to do that after you have the infusions. And that provides more data for the doctors. Yale will reimburse you up to $1,400 for your time for the infusions. And if you do volunteer for the MRI scan, that's an additional $600. To sign up for the trial, you contact the research assistant, Sophie Elliott, at the phone number that's on the card. And again, Yale currently has 31 people that completed the trial, right? And there are 2 right now that are in the process of receiving infusions. So hopefully they finish and they'll be up to 33, but we still need volunteers. If the participants will receive the trial results in approximately a year. The doctor's going to have your number. She stays in touch with everybody that participated. Brenda will talk more about that. But you will receive the trial results. And the conclusion of the trial, it's they believe in late 2025, the trial will be completed. So I'm going to let Brenda have the floor now. Brenda's another Cure Now ambassador, and she has a lot more insight than I do. So thank you, Brenda.
Hi, everybody. Thank you for having us here today to talk about the trial, the ketamine trial. I do have Parkinson's. I was diagnosed in 2012, and at that time I was 49 years old. Am I speaking through here? Yeah. Okay, through there? Okay. So I was diagnosed in 2012, and lower it a little bit. And at that time I was 49 years old, still working. My family was still a little bit. My kids were almost done with school. off to college, and then I got the rug pulled out from under me. So,
Is that better?
yeah, thanks. With that diagnosis, I worked for another year, and then I had to stop because I just couldn't do it any longer. It just was not happening, so I had to stop working. But several years after I was diagnosed, I started to get involved in clinical trials, and I've done several up in Boston, at BU. I've done several now done at Yale, and I do them because it's the only thing that I can control with this Parkinson's. I can make the decisions to do them or not, and I feel like I'm contributing to I'm contributing to the cause here, to try and find a cure, to try and find new medications for us to take that don't have as many side effects. So that's how I feel I can contribute. So that's why I do the clinical trials. The trial down at Yale, I did participate in that. It was I was one of the first few that went through. I think it was number 4 or 5 that went through the program. And like Daria said, it's it's 4 things you have to do. You first talk with Sophie, and she gets all of your information, and she passes it on to Dr. Downs, Sophie Downs, and you'll talk with her, go down and meet with her, and she will evaluate you clinically and cognitively and physically. And if you have Parkinson's, you've been through the neurologist, you do all the same tests. You do the finger tapping and the stomping of your feet and the hands, and they do those physical tests on you as well. And then they do the cognitive. The cognitive tests are very involved. I find those those are the ones that make me the most tired, the most fatigued, because you're gonna constantly be thinking of something. And you've probably are familiar with the tests as well. You have to, she'll read a story to you, maybe a full paragraph of maybe 10 sentences, and then they want you to repeat it word for word. And I just can't do that. I've done it many times, and I've heard the same story many times, and I still can't get it right. Another test is counting back from 100 by sevens. Forget that, can't do that either. I get down to like 80 something and I'm done. Other tests that they do, the story, there's all kinds of tests. Tell as fast as you can in a minute, tell me how many words you can think of that begin with the letter F, letter F, letter S. You think you know those words, and you think they would come to you easily, but they don't after you've said maybe 10 of them. So you go through that process, and then with talking with Dr. Holmes, and then she will determine if you're fit. She will evaluate you to see if you are clinically depressed, and of course I was at the time. That's why I got into the trial. So I was accepted into the trial, and I started with the infusions. I went down to Yale. At that time, they didn't have the transportation, so that's a very good benefit for those who who need transportation. I had been driven down there. My husband went with me and drove me down. And so I went through the infusions twice a week for 3 weeks. And the infusions themselves it sounds scary, but it's really not. It's you go down to Yale, and Dr. Holmes is there, one of the head of the psychiatric unit there, Dr. Sanacora. He's the head chief of the trial. He's the high level one on the trial. So Dr. Holmes is the research professor who's really doing the trial. So Dr. Sanacora is there with you, and Dr. Holmes. So they're with you. Dr. Holmes is with you the entire time you go down there for the infusion, as well as your own nurse. You go into Yale. They get you set up in the room where the ketamine is, where they do the ketamine infusion. And your own nurse, she stays with you, or he stays with you the entire time you're there. You're never alone. And I know Daria was talking about communication and how a lot of the trials fail because of lack of communication. And I'm telling you, they are constantly with you. They're constantly communicating with you about what's going on, what's happening. This is what's going to happen next. And it makes you very, very comfortable. And you begin to have a relationship with them because you're with them twice a week. So, and now I've done many trials, so I get to know them and they get to know me. So, so doing the infusions, you go in there and the nurse is there, and she gets you all set up with the IV. It's done through an IV, and you kind of lay in the bed there and on the stretcher, the bed, hospital bed, and they put the IV in, and you just kind of relax for a little while. And then the pharmacist at Yale, he is the one that mixes the ketamine or the placebo, because you don't know which one you're going to get. So he decides which one you're going to get. Dr. Holmes doesn't know, and Dr. Sanacora doesn't know which one you're getting. So the pharmacist mixes the drug together, and it comes down, and then they start the infusion. The bag is about that big of the infusion, but it goes in very, very slow. And at that time, during the infusion, the nurse is constantly monitoring you, your heart rate, your blood pressure, all your vital signs. Those are constantly being monitored. So the infusion goes in. It takes about 45 minutes actually for it to be that bag to be fully empty, and you're totally infused with it. I believe during the infusions that I had gotten the ketamine twice, and I feel I think I got it because I could tell when it was going in how it was kind of like just relaxing my whole body. And by the time it was completely done, I was like, oh, I can do anything. I was very relaxed. I was in a very peaceful state. No tremors. Tremors is one of my biggest symptoms. So the tremors were very relaxed. My leg wasn't shaking. My hand wasn't shaking. I couldn't really talk too much because when I got the ketamine, because I think it made me so peaceful that I was like dreaming, like I was in a dream state. So I got that. I felt like that twice during the infusions. And the other times that where I think I didn't get it, I just felt like I feel now. I didn't feel any different. But during those 2 times, I did feel that I was definitely had received it. So what happens then is after the infusion is done, Dr. Holmes will come to you, and she has a list of questions that she will ask you. And this is how they evaluate whether you got the placebo or whether you got the ketamine. And it's a series of different questions. She will ask you those questions, and then she will go away for a little while, and then you have to just rest for the next maybe 45, 50 minutes, because then the ketamine is starting to be released from your system because it's such a small dosage. And when she feels that time is up, she'll come back to you, and she will ask you those same questions again. And I believe they take those questions and they compare them to see, and I think that gives them some type of indication how you answered those questions, whether you received the ketamine or not. And I can remember one question that stands out, and I tell this to everybody. She asked me, I was laying on the bed, and she asked me if people around me seemed like they were mechanical, kind of like robotic. And I said, yes. I said, yeah, they were walking around like they're robots. And I could hear her chuckling. So then she went away, and then she came back like an hour later, asked me the same questions again. And she asked me that question. Of course, I said, no one seems like they're mechanical, like they're robots. So it really alters your frame of mind on reality, really. But what happened is, when I was done with the infusions, the 6 infusions, I think I had it twice. And not only are you receiving the infusions, the medications I take make my mouth very, very dry. So at the end of the infusions, you have your follow-up appointment with Dr. Holmes and Dr. Sanacora. And I think they do that on Zoom too. I'm not 100% sure. I think one of them was on Zoom, because it was was right after we wear masks and stuff. But now so maybe it is in person now. But they'll follow up with you to see how you're doing. One of the important things that I felt that I received from the trial after receiving the ketamine is not only are you getting the infusions, but you're also getting the opportunity to talk to these doctors. And for me, when I was so depressed at the time that I felt like I was talking to a therapist, like I was being able to tell them why I was so depressed and what was happening in my life at the time. And, you know, they told me, it's okay. It's not your fault. It's okay. And we went through this many times and talking. Every time I went down there, I talked with one of them. And it really made me feel like it was okay. I was going to be okay. This wasn't going to control my life. This was making me so depressed. So I really think that that was very beneficial, at least for me. If you feel that you can talk to somebody, and Daria was talking about trusting the doctors. Well, I trust these doctors because I've spent a lot of time with them, and they really want to help us. They're very passionate about what they do, and they want to find a cure. They want to find drugs to make it better for us. And so I really felt that was very beneficial for me. And Dr. Senecora is the head guy at the Yale psychiatric unit, and he's been working on ketamine for 25 years. And the breakthroughs that they have received in this drug, he's very excited about, and he really feels that this is really going to benefit people. It's not approved yet because, of course, the trial is still going on. They need more people. I hope they get it, because if they don't get the people, I think they lose the funding after that, I think. I'm not 100% sure of that, but they need some more people to go through the trial. I found it to be very beneficial. I have not received any ketamine since that trial because I've been fine. I felt that the effects of going through the process and then talking with those doctors, it helped me get to where I am now. And I wouldn't have gotten this far if I had not gone down there and went through this trial, because I was in that black hole that people fall into when they're depressed. It's happened to me twice in my life. First time when I was diagnosed, and then this second time which was a couple of years ago now, that I went down to do this trial. So I'm a big proponent of it. I think, like I said, it's the only way that I can participate with these doctors and help them to find a cure for us, because they want to. They're very, very passionate. They want to help us. They want to find new drugs. And I would like them to find new drugs that with less side effects. That's what I was hoping for. Is there going to be a cure in my lifetime? I don't know. I hope so. I hope there will be. But if I can get a drug that has less side effects for me to take, I will take it. So that's kind of my experience with Yale. It was certainly a very good one for me. I've never had a bad experience down there. Like I said, the transportation I think is great, because there are a lot of people that just can't, get transportation down there. You're very close to Yale here, which I didn't realize until I got down here. So it's interesting. I'm anxious to see the results of the trial and to see how many times I actually did receive the ketamine, whether it was more than 2 or not. I would be surprised if it was, but I think it was at least 2 times. So I will be interested to see the results of that, and to hopefully the trial will get completed and it will be funded, and they can move forward with getting it approved through the FDA. So, any questions or like to ask? Or thank you for it's a very high percentage. Depression is one of the symptoms of the Parkinson, so many people suffer from it. I don't have an actual statistic, but my guess is it's high. It's a high percentage.
So, and also too, like, how do you become an ambassador? Because I lost my grandmother at 93. It's a 93 Parkinson's.
Oh.
Everyone's complaining.
Oh, good.
So,
God bless her.
like, I would love to be some. I mean, obviously, Terry's doing this whole thing, and
Yeah.
we're here doing it. But
Yeah.
obviously, if people like myself or Ben, who also has a grandparent with
Oh.
Parkinson's, wants to get involved, how would you do that?
Daria, get in touch with.
I can give you my business card.
Yeah.
We're looking for additional ambassadors, so thank you.
Yes.
Really, there's only 3 of us. Linda is another one.
Yeah.
She couldn't make it today, but Cure Now is looking for more. And not only are we helping Yale, like this particular trial, we're helping. This is our first ambassadorship with Yale.
This is the first one.
And other people on the board for trying to get UConn Health and Hartford Healthcare
Okay.
to use our services to spread the word about any trials they're going to be doing. So we definitely need more ambassadors, and we have a Zoom every Thursday afternoon with Yale Doctor and Cure Now. There's like 5 people on the board, and the research assistant, Sophie Elliott.
Yeah.
And we already told them we need more ambassadors.
Yeah, we need more people to spread the word, make the awareness.
I'll give my card, and then Kelly Carney is the lead for Cure Now, and he coordinates a lot of the things that we're doing, the logistics, and working with the doctors and politicians as well.
Yeah.
With the hospitals.
Yeah.
So that would be great if you could volunteer that.
Yeah, that would be great. We need more people to help.
Also, like out of all the trials, which one have you found that has been the most beneficial?
This one, the ketamine trial. It's the one that there was something that I needed help with, and it helped me. Some of the trials you go through, you're participating to get to be a participant in the trial. I've done many, like I've done trials on speech. I've done trials on hearing. I've done many exercising. I've done a lot. And this one I found to be most beneficial because it affected me and it helped me get over a period in my life where it was really very traumatic at the time. So this was the most beneficial for me.
There were two infusions.
2 times a week,
For 2 weeks.
3 weeks. So the total of 6 infusions you get.
I would imagine that you received either ketamine or placebo during all of them, not some with, I think they're looking for long-term effect of the drug.
Yeah.
So I assume if you had 6 infusions, they were either all ketamine or all placebo.
I don't know.
I would doubt that they would do 1 week placebo, 1 week ketamine.
Yeah,
You have no idea.
you have no idea when you're getting it. I can only yeah, I could well, I don't know about if it was the placebo making me feel better, but I can compare how I felt when I had what I think was the placebo and when I think it was the ketamine. So that I don't know, but that's why I'm going to be anxious to see what they give you.
You might find out because you're giving these lectures or talks.
Yeah.
That you just received placebo or just received the
Yeah.
drug, because it would seem, it would make sense to me to receive placebo 1 week and then the drug the next week and then placebo, because how they're looking for an effect over more than 3 weeks.
Daria, did you want to say?
That's a great point.
Yeah.
So the doctor, that is a great point. Brenda's not going to know what she got until the end of the trial, after the results are
She got
in.
one or the other. She didn't get all today.
You're right. So
Yeah.
we get asked a lot of questions, and one of them is, oh, do we get it, all 3 times? Brenda said she felt like she feels like that she got ketamine twice, but won't know to the end. And the 3rd time, Brenda said she didn't feel anything. So sometimes people that do get the ketamine, according to Dr. Sophie Holmes, they don't experience any, they don't feel anything. So maybe she did get it the first 2 times, and the 3rd time she got it, but she just didn't feel it.
Yeah.
So again, she won't know.
Don't know.
We won't know the results to the end, but that is a great point.
Yeah.
And I mean,
and everybody,
you know how you felt.
yeah, and everybody's probably different too. Yeah. I mean, I may have gotten it more than twice. Where I'm thinking I may have gotten it more than twice, and I'm thinking maybe it was the placebo, but maybe it wasn't, and it didn't affect me that time. I don't know, but I definitely felt different, at least twice that I can recall. So we'll find out.
You're right, sir.
Yeah.
It's just very misleading if you say, "Oh, I felt good one time, it was drug, the next time I was placebo." I'm sure with 6 infusions, they're all either placebo or ketamine. I doubt they alternate.
Yeah,
You might find that out.
yeah, maybe, yeah, that's probably something we will find out. If they say, if that would be interesting if I received it 6 times. but it definitely made a difference for me. And I think everybody's individual too in that regard. So it's going to affect people differently and your level of depression. And so I think there's a lot of factors to include in that as well. So yeah, I mean, it definitely worked in combination with talking to the doctors down there. It definitely made a huge difference in my life. Yes. Yeah, that's what's important. Yeah, yeah.
How long is the trial? I know you're looking for more people and everything. How long is the window?
Next year.
That's another great
Yeah,
question.
yeah.
So they have 12 more months to complete the trial.
Yeah.
And there is a slight chance they could get an extension, and Michael J. Fox would fund that.
Mhm.
But we're already going on almost like 2.5 years. So
Yeah.
they want to get it done. So yeah, another 12 months, but we're out, once every other week.
Yeah, talking to people. Yeah.
In Connecticut, and going to, if anybody boxes, you do the Rock Steady boxing or the Beat Parkinson's Disease Today boxing for Parkinson's patients. We also speak to exercise groups to try to get them to come in.
Yeah.
So we're out there pounding the pavement.
Yeah, we'll talk to anybody to see if we can get more people to get to do the trial, to get it completed.
So another thing we wanted to talk about, another reason to do these trials is these doctors are collecting data points on your participation. It goes into a database, and other neurologists can access this database. If maybe they're working on some other drug, they all have access. So that just helps, doctors that are trying to find a cure for Parkinson's. It gives them more data points to work with. And it's a struggle. So Michelle Hespiller, she's my friend, and she's the one that encouraged me, she asked me to be an ambassador, and she told me that her drug, the drug she uses, was created in 1965. And she's like, no new drugs really have helped.
And nothing's been since.
She said she and Steve DeWitt that started Cure Now, they had to advocate and their spouses for themselves. And she said it's depressing on top of the Parkinson's she has. She has to go out and fight, And she told me she'd stand outside Harvard Healthcare and pass out these pamphlets.
Yeah.
Because she wants everybody to hear and to learn that we need.
So we need more. We need people to participate, and we need the doctors to come up with some new drugs. In 1965 is kind of it's an old drug.
Yeah. We encourage you to at least make the phone call and talk to Sophie Elliott.
Yep.
And then other trials on the Michael J. Fox website. There's a list of trials that are ongoing, and maybe you can look at those and participate in those too.
And some of those trials are just going online and answering questionnaires. I know there's one that I'm doing now. It's PPMI. It's through Michael J. Fox, and that's just online. You don't even have to go anywhere. You just go if you have a computer and can do it. It's
You had mentioned that this trial you have to be between 40 and 80 years old. What about the people who are over 80?
Who are over 80? Yeah.
Are there trials for those people that are over 80?
Well, there's this particular one is that age bracket.
Right,
Yeah.
But are there additional trials outside of this? That, like you were saying, that on the Michael J. Fox, if you go on the website, will it say that there's trials for people over 80?
You can read the criteria. There's different criteria depending on the trial.
Because this one involves ketamine.
Yeah.
So we talked to Dr. Sophie Holmes about this in one of our Zoom meetings, because someone in our audience asked the question. The guy was 80.
He was like 80. He was like, I think he was 81.
Yeah, he was 81. He looked super fit.
Yeah,
he wanted to participate, and so he's like, I'm 81. I'd like to participate. So let me see if they'll do an exception. So we talked to Sophie Holmes on the Zoom, and she said no, just for liability. So it's kind of a risk to administer ketamine to someone over 80, younger than she can't make an exception. But other trials don't involve drugs.
And
And
there,
then this is a hard trial to
Yeah.
promote because, ketamine, just like opioids, they get obviously abused.
it's
They
a,
can be abused by
Yeah.
people that are addicted.
yeah,
This one, this trial, it's monitored by the doctor and a staff of nurses.
yeah. So
So people are,
you can't just, you just can't take ketamine. It has to be under a controlled environment with the doctors, because it can be. And there's been a lot of in the news recently about ketamine and people taking it, themselves and with not, it needs to be under a doctor's care, most certainly. Need to be under a doctor's care with it.
And I stepped out for a minute, but did you go through the MRI part of this?
I did not go through the MRI part at the time. I just chose not to do it for whatever reason. I don't remember back then, but I did not participate in that. But my guess is it's if you've had MRIs before, they probably have you do different tasks when you're in the MRI machine. I've had many MRIs done, with different trials, and as long as you can be in a enclosed environment for that long period of time, otherwise it's really not that bad.
So if you volunteer for the MRI portion, they'll do a brain scan before you get your first infusion, and then after your last infusion, they'll do a scan. But that's optional.
Yeah, that part of it is optional.
Yeah.
Yeah.
So I wanna go over just a few questions that other people had at our other presentations. Just real quick. Some of the questions, one of them was, can I stay on my PD medication or my psychiatric medication? The answer is yes. You'll talk to the doctor about this, but the answer is yes. You can stay on all your medications, and the doctor will obviously go over every medication you're on. Another question, do I have to come in person for every infusion? The answer is yes. You would have to go down to Yale, New Haven. Yeah, some people ask, can they admit it, give it to me in a tablet, I'll do it at home. No, that defeats the whole purpose. So it has to be a control, like Brenda said, a controlled environment with the doctor and a team of nurses.
Mm-hmm.
So you have to do it in person. Is it possible to do infusions once a week for 6 weeks? No, you have to do it twice a week for 3 weeks, for a total of 6. Who determines if you have depression? The Yale does a structured interview.
Mm-hmm.
And then, is ketamine safe? What are the side effects? And this is coming from Dr. Sophie Holmes. The study coordinator can speak more to the specifics of ketamine, but it is considered safe at sub-anesthetic low doses, administered in a clinical setting.
Mm-hmm.
How much longer are we running this study? Approximately 1 more year. And that's it. Does anybody have any other questions?
Piece of legislation that passed the Senate and had it Biden test, I guess. But how will that be administered? Who's going to approve it? There's all the different departments that are Bethesda, different research facilities that are there.
I don't
I'm
know.
not sure, sir.
Yeah. That was the first I heard about that.
I would assume the way it was with cancer 40 years ago, money, you're gonna fight kill cancer, but it's just grant money to researchers to do the research.
Oh, yeah, that makes sense. But
Kill cancer and
yeah.
Terry, do you know who would administer that program?
I don't know. No. All I got was that it was Senate passed and that they were waiting for Biden to just approve for that to happen.
And that was just done this week?
It was done on the 23rd, last Thursday.
Gotta look that up. Let's see.
Thank you.
Thank you. Thank you.
All right, thank you, Terry, and for the JCC, and for all you guys that were here
Yeah,
to
thank
listen
you.
to us. We appreciate it, and if you could spread the word to your friends and
Mhm.
family, and then take our business cards and any other items that are on the back table, that would be great.
Yeah. Spread the word. Key.
Thank you.
Thank you. Thank you. Thank you.
I'm gonna take that mic for
Oh,
a
yeah.
second.
Yeah.
Great.